Severe obesity is a serious disease that interferes with your daily activities, threatens your health, and can shorten your life. Hi, I'm Dr. Karl Strom, Medical Director of the Bariatric Program at Hackensack, UMC, Mountainside. Obesity is a multifactorial disease that can lead to other diseases such as high cholesterol, hypertension, heart disease, diabetes, sleep apnea, and even certain cancers. My team and I are here to help you take the first step. The normal treatment for obesity is diet, exercise, and behavioral modification. Now, if I ask you, have you ever been on a diet? Most people say yes. They've tried either Weight Watchers, Nutrisystem, OptiFast. What happens is they lose approximately maybe 10, 20, 30 pounds, and they fall off that diet, and they gain that weight back and a little bit more. That's called seesawing. Surgery is kind of like the policeman or the speed bump when you go into the parking lot. Once you lose the weight, you maintain the weight loss and you don't go backwards. When you go on a diet, you change the types of food, like I said, but also you eat a lower calorie diet, which means a smaller volume. It never stretches this big stomach. If it doesn't stretch the big stomach, no hormones are released that go back to your brain to say you're full. So, how does bariatric surgery work? We trick your brain to think you're full with a smaller amount of meal, which is a lower calorie diet. The first procedure is the laparoscopic gastric band. This is a restrictive procedure in nature. How it works, it acts like a funnel. The funnel opening is small. As the food gets digested, it trickles through slowly. You lose approximately 1 to 3 pounds a week. About 50% of your excess body fat is lost in the first year. That's if you stay compliant with me, the dietitian, exercise, and support groups. Now you're going to lose that weight, but you're going to maintain that weight loss for years to come. Now as you start losing weight, that funnel opening gets a little bigger, the food goes through a little faster, and the weight loss slows down. So I have a little catheter that I attach to this port. This port's located underneath your skin. Does it limit your activities? Not at all. We have professional football players that have this procedure. The nice thing about the band is it's easily reversible. I don't change the anatomy at all, and there's no vitamin or mineral deficiencies associated with it. The laparoscopic gastric sleeve is a restrictive procedure. This one, we divide the stomach to make a very long, narrow channel. The new shape is the shape of a banana. The new size, half the size of your fists. The nice thing is, I don't change the lower anatomy like you do in a gastric bypass, so there is no malabsorption and the vitamin deficiencies aren't as severe, and I remove a portion of stomach which has a lot of hormones that make you hungry. Combination of all this, you lose approximately 50 to 60% of your excess body fat in the first year. The laparoscopic gastric bypass is a restrictive and malabsorptive procedure. In this one, we divide the stomach to make a small pouch. The new size of the stomach, half the size of your fist. Okay, the difference here is we reroute the intestinal tract downstream 125 centimeters, so as food travels through the first limb, no calories are absorbed. That's called malabsorption. The combination of the restriction and the malabsorption, you lose approximately 60 to 70% of your excess body fat in the first year. No matter which procedure you do though, it doesn't matter because within 2 years, they all approximate the same weight loss. How do you choose which procedure is right for you? At a consult, we'll go over your medical history and see if there's a medical reason that one might be better than another for you. But 90% of the time, whichever tool you choose is the best tool for you, and that's how you're going to succeed. I can't tell you which procedure to have. We have to work as a team to make this decision. From the day of consult to surgery usually takes anywhere from 2 to 6 months, depending on the insurance requirements. As far as the pre-workup at this time, you're going to see our dietitian. They're going to help you understand not only what you're going through, but what life's going to be like afterwards. You're going to see a behavioral specialist. That's what the insurance company wants, to make sure you understand what you're going through. And me, I want to make sure it's safe. You're going to see a gastroenterologist, a pulmonologist, and a cardiologist to make sure this is a safe procedure for you. We have a clinical nurse specialist that are going to reach out during your physical to make sure all your testing is done and safe before surgery. Under our care, you'll be treated by board-certified surgeons, all fellowship trained, no nurse practitioners, no residents, no fellows. You'll have a board-certified surgeon available 24 hours a day, 7 days a week to take care of you. Afterwards, most of the questions are geared toward the dietitian. They're available by phone, email, every day. We have a support group that's free. It's once a month. It's led by the dietitian and a behavioral specialist. We have exercise programs available at the hospital that are medically directed, that are geared for our bariatric patients. Here at Hackensack UMC Mountainside, everybody within the whole facility has been trained to make sure this is a safe and seamless process for you. My team and I will help you through the whole process to make sure it's a safe, easy, and successful journey.